Hey, my name is Fidel. I've been coming out this way for almost 10 years now, and I'm a I was a member of the GRAC um, for the MS National MS Society. We go and advocate for people with disabilities to Capitol Hill and to Richmond. Um, people they stand outside with signs and scream at the building when you drive by. Well, you get more results if you put on a suit and make an appointment and go in and talk to your representatives. Um, that was a that was a fun experience. They do a lot of good things for a lot of people with disabilities. Um, I did have HSCT. That's the medical name of the procedure, the stem cell therapy combined with the chemotherapy. Suzanne hit the nail on the head. There's a lot of scammers out there that'll try to sell you snake oil when it comes to that procedure. There's a lot of, I guess, misinformation. Um, it's not a end all to the disease. It's not a miracle. What it does is it halts severe disease progression by wiping out your entire immune system, and it utilizes the stem cells to regrow your immune system, your own stem cells, in 5 to 7 days, where it would normally take 6 months or longer to get you back to safe levels, to where you could go back outside and not fear of dying from catching a common cold. Um, it's finally becoming more mainstream in the U.S. I had the procedure with Dr. Ruiz in Mexico. He is the one of the founders of the procedure to use it um, for MS, and I believe it's a really big help. The sooner you can get it done, the sooner you're diagnosed. I believe that in the long run, you have better odds of you having the most benefit from the procedure. Like I said, there's people that were diagnosed after me that are now a lot farther into their disabilities um, than I am, and I equate that to having the HSCT procedure. Um, I'm also on life imaging studies at NIH in Bethesda. If anybody's interested, it's free to join. They actually pay to get you out there once a year. You stay in a hotel nearby, um, and they do amazing imaging studies as far as well as physical workups. You meet with the neuros and the teams up there. Um, any kind of test you could think of that your doctor out this way wants done, they do it for free out there. Um, it's included in the study. At the end of that study, when you pass away, your brain and spinal cord will be donated to NIH so they can actually see the physical effects on the brain and the spinal cord. Um, they say it all the time. The team does that. They see it on MRIs all day long, but to actually be able to see it in real life, it's really harder to do that. But it's a great team out that way. So anybody interested, I'd be happy to give you the information. And with that, any questions for me? If you think of anything, I'll pass the mic down. But
So after your procedure, did you halt any progression of the disease? So the damage that you had was still there, but you just didn't get any more damage?
yeah, that's pretty much where I'm at. I took it upon myself to start a maintenance DMT um, as per the protocol at the Ruiz Clinic. Um, Dr. Ruiz wanted you to be on a a drug called rituximab. Um, basically it's Ocrevus, but it's the B cell targeting CD20. Um, so I'm on Kesimpta, and I've been good ever since. And I had it done back in 2017. So.
So if anybody else has any more questions for Fidel, if you'll just write them down. If your question is geared to somebody, just write their name on the top of your question. So.
All right, so many of you know that I'm a speech pathologist since 1994, which was long before I was diagnosed in 2010. In 2007, I went and became certified in a process called VitalStim, which is neuromuscular electrical stimulation for swallowing. And so I felt at that time, as I had already been a speech pathologist for a long time, that that was the new and upcoming and most recent effective treatment for swallowing and neurological disorders, not only MS, but others as well. And along those lines, as a speech pathologist, I also am tasked with serving people with cognitive abilities or disorders, to include neurocognitive rehab, which is something that people with MS should have at least once in their journey. And there's less than 6 of us that provide that service in the state of Virginia. So I wanted to talk a little bit about swallowing, since that seems to be a big issue with people with MS. And I am not free from that issue. So with the swallowing, it can have very subtle symptoms, and probably some of the top 6 symptoms that I often occur are throat clearing, feeling like you have something stuck in your throat, having to swallow many times to get it down, chewing longer, drinking more liquids during your meal, and then just the overall consensus of weak feeling in the muscles of your throat. Again, like I had said earlier, the neuromuscular electrical stimulation is the best treatment for swallowing in people, especially in people with neurological diseases, because what it does is it electrically stimulates your nerves, which operates all of your muscles. I truly believe in that treatment. I have since I became certified in the early 2000s. I've had really good luck with it. I've had stroke patients that have come in on feeding tubes and have walked out of rehab, not literally, but have left the rehab centers eating regular food and drinking regular liquids with this process. Sorry. So I also wanted to talk a little bit about patient-centered care. I know that's kind of a theme for the weekend. For me, without patient-centered care and an active participant with the patient, the speech therapy does not work. And like a common theme that may come up with Courtney is that if the patients don't participate and buy into the therapy and do the tasks and things that we give them to do outside of the therapy, you're not going to achieve optimal results. Did anybody have any questions?
If you could write them down, that'd be great. And then we'll go over them. Yeah, thank you. Thank you. Perfect.
I'm Courtney. I'm a physical therapist. I work for, technically I'm the owner, but I also work for NeuroRehab CoLab because I work for all my patients. So we started this company. It's me, a physician. She's a physical medicine rehab physician, and I can answer more questions about that because a lot of people are confused about what that means. And then our occupational therapist, and then we also have some speech therapists as well, and a fitness trainer who specializes. She's a physical therapy assistant. She actually specializes in working with people who have complex conditions and getting them back on track after you discharge from therapy. Part of the reason we started this practice was because we all worked in the hospital on an inpatient rehab basis. And, you know, when you're in a hospital, you're getting care from every single perspective that you can. So you're getting it from the gastroenterologist, maybe the orthopedic doctor, maybe the neurologist, the PM&R physician, and then you have all your therapy. So everybody's collaborating when you're in the hospital, but what happens, and we've heard this time and time again, is people were discharged home and then they felt like they were all on their own. There was no one there to advocate for them and try to communicate with other providers to help them, because as a patient, you're already overwhelmed. There's already so much going on. So you should have a healthcare provider that's on your side, that's wanting to collaborate with other people so that you don't feel like you have to do it all on your own. Another reason that we started this practice is because we felt like just in the Roanoke Valley area, there wasn't a great resource for folks who had neurological conditions. So that could be spinal cord, Parkinson's, MS, stroke. There's a lot of PTs in the area that aren't as specialized, and they more so treat orthopedic conditions. So that'd be like you have shoulder pain, or you have knee pain, you have ankle pain, things like that. But we wanted a place where you could come and somebody actually knew what MS was. Somebody actually maybe knew what Parkinson's was. Somebody knew that these two diseases are treated very differently and knows how to go about that process. We are soon, hopefully this year, starting up a concussion clinic, because as we know, if you have balance issues, you're at high risk for falling, you're at a high risk for hitting your head. So not only will we just be treating, general folks in the area, but we want people who have complex conditions to be able to feel like they can come in and get treated, and they're not just like another athlete coming in and getting treated and then being back on their way. So that's a little bit about what we do. We also offer services. Our occupational therapist does driving rehabilitation, so I can try to answer some questions about that. And if I can't answer the questions today, then I'll get your email and I'll make sure she reaches out to you and she can answer the questions.
Thank you. And if you have questions for Courtney, let me know. If you're using the mic, if you can hold it out a little bit, we won't get the feedback. Maybe that's what we think we've discovered.
Let me know if it sounds okay. My name is Marian Thomas. I'm a nurse practitioner at Blue Ridge Associates in Neurology and Multiple Sclerosis Center. Many of you all know this as Dr. Kramer's former practice. We've been open and seeing patients in September. We have our clinic in Salem, which is predominantly multiple sclerosis, as well as infusions for multiple sclerosis. And then we have our Christiansburg location where Sarah Champion works, which is a combination of general neurology and MS as well. Again, also doing infusions there. My goal today being on this panel is just, to have open conversations about patient-centered care. Some things that, you all may stress about when coming into your appointment with your neurologist, or worry that, you feel as though you can't talk about, or questions, concerns, anything, I know most of you in this room at this point. I'm an open book, and I just want to make your MS journey with your neurology provider as vulnerable as possible, because you only have a couple opportunities a year to have these appointments and have these conversations. And so the more meaningful that they can be, the more beneficial it is for me as a provider, for your provider, as well as for you all. So that is what I'm here to do.
Thank you very, very much.
Awesome. I'm Hannah Borney. I know many of you. I help to co-facilitate the daytime support group with the amazing Christy Litchard, which she's always behind the scenes doing things, so I'm sure you've seen her around. Also Katie Meyer, who is currently in the hospital, but we're thinking about her, wish she could be with us. So that is what I do as part of this group. And then in my professional life, I am a health and wellness coach. And that means that I help people, particularly people who are living with MS, to be their happiest and healthiest selves. And that can be, coaching. Oftentimes when I tell people I am a health and wellness coach, I get a little bit of a glazed over look, because people are like, cool. That sounds great. But it's hard to kind of really understand what health and wellness coaching is. So I just want to kind of enlighten you a little bit. So I want to start by asking you the question, what is most important to you? What matters the most to you in your life right now? Peace. That's beautiful. if you're like me and many of the people that I work with, or most people that I know, they say something along the lines of time. I want time with the people that matter to me. I want time with the people that and the things that matter most to me. And when you don't feel great, when you don't feel your best, when your energy is low, when your stress is high, when you're not sleeping great, all of those types of factors in your life, when those are not kind of at their best, you just don't feel your best. And life is really way too short to spend any less time with the things that matter and the people that matter the most to you. So, as a health and wellness coach, that's what I do. I help you address those quality of life factors to help you feel like you can do and be the person that you really want to do and be in the world. So you may get recommendations from your speech pathologist or your physical therapist or your nurse practitioner or any other provider in your life, and you're like, okay, great, that sounds great. I would love to eat smart and move more and manage my stress and sleep hygiene. I'm sure many of you have heard the term sleep hygiene, all of those types of things. And so you know in your mind some of those things that you're like, yeah, I need to be doing X, Y, or Z, but for whatever reason, you're not doing it. And that is where coaching can come in and really help you to bridge that gap between knowing what you need to do and then actually doing it in your real life so that you're making progress with these things and feeling like you're living a more quality life that you know you're capable of, you know that you deserve, you know that you are worth the time and investment in that type of quality life. So anyhow, that's a little bit about what coaching is.
Thank you.
Thanks.
Yeah.
Yeah, hi, I'm Russ Weiner, and if I'd known I was going to be on the panel, I might have shaved. So, I have a really eclectic background, but the last, since 1994, I've been taking care of my wife. She's had MS, and due to her MS, I got involved with WellSpouse, and then I also became involved with the National Multiple Sclerosis Society, and through them, I became participated with the MS Alliance. We've been attending meetings for maybe close to 20 years now.
You need to pull the mic a little
Oh,
closer.
sorry.
That's right.
Yeah, so we've been attending meetings here for almost 20 years with first the National Multiple Sclerosis Society, and then with this group specifically. So I've really enjoyed participating with everyone here. My background is, as I said, is really, really diverse. I did go to medical school, but I'm not an MD. I'm a public health and environmental health researcher, and I spent my entire career doing research of various types.
Hold your mic up a little further, sorry.
So, did anybody having trouble hearing me at this point?
Good now.
Okay.
You can hear it now.
Okay. So I've done a lot of different things technically, and I have a background in even exposure assessment. I'm a certified industrial hygienist. I was faculty at UNC in public health, and I was faculty at North Carolina State University in Marine, Earth, and Atmospheric Sciences. And I used to like to lobby Congress, which was another somewhat stimulating activity. But so I have a lot of different backgrounds in health and in politics and in just a wide range of technical subjects. So if you have technical questions about MS, I also like to refer to my son, who's a neurologist now anyway. And so I can usually get questions either answered or get them answered fairly quickly. There's one doctor who will actually pick up the phone when I call. He owes me a lot of money right now, so that's probably why. Anyway, but that's basically my background. And so if I can help in any way, I have a lot of experience with talking with doctors and working with doctors. As Suzanne said, I used to work for a while with Consumer Reports. They had an initiative where they were trying to get community groups active. And I was doing a course on preventing medical harm. Part of that was patient-centered care. There are other aspects to it which are all pertinent. One of the big things, like if you're going to see a doctor, especially if you're going to the hospital, you want to have a care advocate with you, somebody who's going to watch out for you and be able to talk and record meetings with your physicians so that you actually have notes and know what was said and can refer to them. So there's a wide range of stuff like that I have experience with.
Thank
So
you so
that was it.
very, very much. Once again, Russ got added at the end here because some people were never sure they're going to make it, and the next one we weren't sure is Sarah. Sarah, do you mind just saying who you are and what you do real quick, or real slow, whatever you want?
I'm Sarah Champion, and I came down here from New York in like 2014, joined Dr. Kramer in her neurology practice, and her love was MS. So I ended up going back to New York. I had a friend that was dying of cancer. Stayed with her for a couple years, and when I came back, we opened the center. And I've been a nurse practitioner since 1998. I've got a background in urology, gastroenterology, internal medicine, and neurology for the past 10 or 12 years. And I think patient-centered care is the most important thing. You need to know what's going on with you, what your options are. Nobody should ever feel forced into doing something they don't feel comfortable with. If there's something that you want to try that we don't think is going to hurt you, I believe in supporting you completely, getting back your results to you as fast as we can, and talking about what can be done about them. I don't like to be bullied, so I like people to have good input. So I work in Christiansburg, as Marion said, she's in the same office, and I do general neurology, but I do a lot of MS.
Thank you very, very much. And could you hand that to
I sure will.
Lee? All I want you to do is just tell what you've told me about how you feel about the massage and how you can help with.
I got into becoming a massage therapist because I was seeing a lot, just like you said, as a CNA, loneliness. The families aren't there because they're so busy and everything, so I decided to go to school and see what I could do with another, without, not knocking doctors, y'all, but when I go into these homes, there's this big box of nothing but medications. And if there's other things, ways that we can not necessarily cure or treat a disease, but slow it down maybe, without having to take so much medication. And I'm sure you all can understand where I'm coming from. And that's why I decided to go to massage therapy. And then the lady that lives in the woods, how I got in touch with Suzanne, I was doing her pedicures and manicures and turning her over her bed because she has MS, and then giving her husband full body massages. So then Suzanne called me and we hooked up. And it's like I said, with massage therapy, I can lessen you all's pain, not cure, diagnose, or any of that. You know, give me a call. I'll be at where Suzanne is in Salem giving massages on Wednesday and on Tuesday, pedicures, manicures, because I'm licensed in cosmetology.
Thank you very much.
Do those things.
So as I said, I hope that when we finish up here, if we can stay somewhat on schedule, that they can, anyone that can, that they can move to tables, individual tables, and you can go talk to them more personal if you want. But in the meantime, one question that was given to me was, and y'all can answer it individually or all of you or whatever, but we'll do the best we can. So what are some of the holistic pain medicine, what are some holistic pain management techniques for nerve pain? I think that might have been directed towards you, Courtney, but you and Marion. So yeah, or yeah, any of you. That's a good question.
Pain is a really hard thing because we always don't know where it's coming from. In the realm of physical therapy, I'm more so thinking a lot of people get neuropathy in their feet. So the best thing we can do is try to find like a really good pair of orthotics for you. But I honestly work a lot with Marion of trying to find a route of, it's really hard to treat neuropathy with just holistic treatment. So that's why I try to do a little bit of holistic treatment with what Marion recommends, because there are a ton of medications in the market that can help you. And I know this question isn't talking about medication necessarily, but I do think that finding a really good pair of shoes that can work for you could be super helpful.
Do you have anything in particular you recommend?
I would say go to, here, I'll tell you. I really like to refer people to Fleet Feet because they'll actually look at your feet specifically and see what is the best orthotic for you. They have like a specialized machine that can do it there. And the return policy is really good. So I like working with them a lot. Some people don't like them, so I usually refer over to, oh my gosh, Good Feet. Good Feet. Good Feet can also do that.
I agree with Courtney in the sense of, neuropathy is one of the most challenging things to tackle. It's right up there with fatigue and spasticity. From a holistic medication or supplemental or what we can do for our body standpoint, again, physical therapy is excellent. The more that we teach our body routine of communication, of use of areas that may be bothersome to us, the more likely to have some not only ways to learn how to adapt to the symptom, but also to have some holistic, meaning non-medicated response and relief. In terms of supplements, I go a lot off of what you all have told me over the years of things that have worked for you. I really like a good magnesium cream, easily found on Amazon. Typically, if somebody's telling me that they're having some issues with neuropathy, I'm going to check your labs, because a lot of times you're having some sort of electrolyte imbalance or vitamin imbalance, and then that kind of teaches me where to tell you to supplement. Because what happens is if you're going out and buying vitamin B12 but your body doesn't need it, it's a waste of your money, but it's also just going to come out in your excretions. So I like to really get a baseline first, but we know vitamin B12 is helpful, magnesium is helpful. Those are two of the biggest supplements. Depending on the area of the body that it is, on top of magnesium cream, you can also do like a Imla cream, so like a lidocaine-based cream. I'll have a lot of patients who have some specifically neuropathy along the thigh area, or just different areas. I have one patient who wears a copper band on his wrist, and he swears by it. So I there's a lot of things out there, but we know, a couple of different things, but I think it's really important if you're having concerns about it, have your provider check your vitamin B12, your magnesium, checking your thyroid, your electrolytes across the board, copper, zinc, things like that, just to see if there's any deficiencies.
While you're holding onto the mic, the last time you spoke at our meeting, one of the things that you said at our meeting, which I thought you described better than I've ever heard described, was the MS brain in falls. We asked you about that, and you were the way you explained it was so great, because I think I said, Dr. Kramer told me one time, I asked her to do a program on falling, and she said, why? I'm like, because everybody's falling. And she said, well, our falls are different. And that was my question. Do you remember your answer? Because it was beautiful.
Was it about roadblocks and communication?
So you were talking about
delays?
how our brain all day long, we're trying to walk.
Yes. So I like to break it down kind of like, when you have MS, and I think the straw example was so good. I'm going to put that in my arsenal. But I think that, when you have MS, you have roadblocks from these lesions, whether they're in your cord or in your brain. And so where a normal electrical pathway of communication goes straight, it's up and down running the central nervous system all day long, yours is running into roadblocks. And so your body is all day trying to accommodate to these roadblocks, which creates a little bit of a delay. If you're driving down the road, you run into a block, you have to take a detour. So it extends your travel period. It's the same thing, whether it's milliseconds or what have you, there's still a delay. And so all day long, your brain is trying to go through this delayed communication pathway. And so by the end of the day, when your brain is slowing down, your body is still playing catch up. That's why things like spasticity can be worse at night, neuropathy, because your body is still trying to play catch up from the communication that it was delayed in getting throughout the day. I hope that makes sense.
Yeah, I mean, I think that's amazing. Don't y'all think that's an amazing answer to something that I have trouble explaining to people? So.
Yeah, and I think too, it applies to your gait and things as well. You know, Courtney and I were talking about this earlier. You know, walking for me takes no effort because I don't have the delay in communication. For you all, when you have the delay in communication, walking takes more thought process. And so, you know, I have patients a lot of times, they'll say to me, I don't fall unless I'm going up the stairs. Well, that's because you're not going up the stairs 24 hours a day. You're not doing that. That's not something that is as routine as walking on a flat surface. So in terms of physical therapy, are you going to get a resolution to your symptom? No, but the more that you can incorporate the routine of something, the less likely that those roadblocks that you have are going to impact your ability. So that's another way to apply that example.
Can I add one thing about that? Just to add one other thing about like the neuropathy is there are a lot of, at the end of the day, I like to call myself an evidence-based provider, but of course some things work for people and there's not great evidence behind it. So it really is what works for each individual person. So there are some studies that show red light therapy could be helpful. We don't do that at our clinic because there's not, from what I read in the studies, there's not great parameters behind it that works with every person, but I have heard from people that they have gotten red light therapy and their neuropathy has gotten better. Something we do in clinic is we use a direct current machine that has helped with some people. So we put it like on the bottom of your feet and up on your thighs, and that has worked with some people. However, the results are mixed. So it's kind of a trial and error, but with red light therapy, just be mindful if you go do it, it is expensive and it may or may not work.
Thank you very much. So we have a couple more. Okay, this is for Marion. How do you feel about a GLP-1 with an MS therapy drug?
Yeah, I think they're great. You know, my reservations with them are not from an MS standpoint, they're more from a GI standpoint because of the studies and such that are out now about pancreatitis and GI bleeds and things like that. You know, but from an MS standpoint, I think that weight and holistically, you know, getting a jump start. I don't like when it's intended to replace the effort that you're going to put in with your lifestyle, because ultimately it will be a crash and burn scenario, and then not only will you not feel great, but your MS will not feel great. So if it's utilized the right way, which I think when patients come to me about this, I like for them to do it through a weight loss clinic, because the weight loss clinic keeps you accountable and also provides you additional lifestyle counseling techniques to accompany the use of the GLP. But I just actually read an article yesterday about GLPs and using it with DMT, so disease modifying therapies. So there's no literature out there against it, I'll say that, but it's not something I would utilize singularly, oh my gosh, singularly to do anything for your MS.
Now this probably is geared to you, but anybody that's involved, you know, please feel free to add any statements you have here. So the question is, I'm sorry, I'm confused about B12 and B complex supplements. Being on Briumvi, which depletes B cells, should B supplements be taken, or would that be counteractive?
Okay, so the B cells that are being referred to in the anti-CD20 therapies are part of your immune system. It's not part of your vitamin B. So it's completely different. They don't have any role with each other. So vitamin B12, you know, B complex is kind of magnesium has a complex out too, because there's so many different types of vitamin B, so many different types of magnesium. You know, when we're looking at specific things, B12 is going to be the most beneficial across the board. But I don't see a problem with a complex as long as it has the right dosing of B12 in it. Hopefully that clarifies though, the B cell is not anything to do with vitamin B. Anybody else want to talk to that?
I think you covered it. Yeah.
So any of you can answer this, or all of you. So what questions, it's this even on? Okay, because I have a loud voice, so I can't hear none. What questions should patients be asking their healthcare providers, but often don't?
All of them. No, I think, you know, what I want to hear from you as a healthcare provider, because a lot of times patients will come in with a list. I love a list. But what I struggle with is if you come in with a problem that's been there for a few days, I want you to talk to me about the last time since I've seen you. Because that, you know, with MS, you know, there's trending things is really important. So if you have something that's going on, I really like to know, has it happened once? Has it happened 10 times? Is it happening every day? That kind of helps me figure, are we dealing with an MS situation? Could there potentially be something else going on? But that's, you know, I want you to feel as comfortable as you can with me in the room. Usually I will prompt you for things, but that's one thing. Keep a list of things that have been going on since the last time you saw me, not just within the past couple of days or a week. It's a little harder to, you know, elaborate on that because it's so short term.
At our next online support group meeting, which is on
April
12th.
17th.
What is it?
April,
Second Tuesday.
it's the second Tuesday of April. Our topic is how to prepare for and get the most out of your neurology appointments. So please come to that. Marion is actually going to be giving us a lot of input, and we'll be collaborating together during our session about what are the questions we should be asking? What are questions you've asked that you have found helpful before? Then maybe that we'll share our wisdom among each other. I think for me personally, as a person living with MS, I know that we all do this, but we're like, is that an MS thing? I don't know. And so just asking, just starting the conversation, like Marion was saying, keeping track, and then looking for those trends and those patterns. And that's kind of what I would say. And come to our support group meeting so we can all kind of continue this conversation and go in with our lists and knowing what we want to talk about.
It's equally important that you also, when you're participating in a meeting with your doctor, just take your own notes so that you can remember what's being said and follow up with them. So it's a good idea also if you like to write your own memoirs or just have a diary, to use diaries to help record what your symptoms are and other things that are going on in your life that might pertain medically to whatever your issues are. So just documenting as much information as you can is just a really good idea. And again, having an advocate with you is also helpful.
I would definitely say, like, going based off of what they said, is don't make assumptions. Because most of the times if you go see an MS specialist like Marion, she's going to ask you all things. But if you go to like a PCP or somewhere different, don't make assumptions that something is normal. Come in and tell, just lay out that list and tell them everything. I've had people who come into physical therapy and they're like, yeah, my foot always does that. And I'm like, okay, that's something we could work on. And I think a lot of times people don't think that things can be improved. I mean, they may not always get to the point to where, we were at when we were 20 years old, but we're all past that point in life. We're not going back to our 20s anymore. So I think just make sure you do not make assumptions, because a lot of PCPs don't really understand MS all the way. And that's just the unfortunate nature of it. So whatever you're there to talk about, don't just make the assumption, oh yeah, my hands are itchy, but that's normal. That happens all the time. Make sure that they know those things. Okay.
Timmy, you don't have anything on that?
I do not.
You do not?
I do not.
Okay. Something that I didn't say that I think is so important, and that's what we're all about, and I shared this with all the panelists before we started this, is social connection is huge. So I was doing a lot of research on social connection, building strong relationships, going to support group meetings and things like this. But with MS, it also can be a challenge, as we all know. Getting ready to go to those meetings and all those things, that's hard. But that's one of the things I asked them for all the people on the panel to, how much we need to stress social interaction. That's so important in every single part of living with MS. When I was diagnosed a long time ago, over 45 years ago, I'd never heard of MS. I'd never met anybody with MS. I didn't know what it was. I thought it was the Jerry Lewis disease. And so, that was a challenge. And I don't know that I wanted to meet anybody, but I finally did at a terrible support group meeting that I walked out of and swore I'd never go to one again in my life. I wasn't going to end up that way. So, but I do know that the disease-modifying drugs work. I know I'm personally proof of that. Paula is a good example of that. And I did want to make sure, this is an uncomfortable statement for me, but I want to make sure everybody knows. So Paula and I've known each other for over 30 years. And she met me in the time of my life where I was in really bad shape. I was basically homebound. And she, in the meantime, got diagnosed with MS, and her children made her come to one of our meetings. And she looks across the room, and there I was, and she came running over to me, and she was like, "I thought you were dead." And I thought I was too. I mean, MS took me down, and there's a whole lot of ways MS can take you down. It doesn't have to be in a wheelchair or speech. It just, sometimes you can't fight anymore. I mean, sometimes it's so hard, and I couldn't fight anymore. When you're as hyper as I am, that fight is even harder because I won't give in to anything. And so it took me down, and I got the benefit of one of the new drugs that came out that people had to fight to get back on the market. Again, that's why we fight. But I think having our social life here is so important. So everybody remember that. That's why we try to have so many different things. Our second Saturday social is social. Our group meetings are a combination of things. We don't care if you just come to the meeting and eat. So Paula nominated me for Remarkable Woman. It's a Fox News thing. And I generally would say no to that. And the easiest way I know to tell you that is that I'm old, and I have, we all have skeletons in our closet and stuff. I could just see all my skeletons jumping out when they put me on TV. And I was like, I don't want to go there. I don't need this. But it was great publicity for the MS Alliance of Virginia. So Paula nominated me, and we made it to the finals. So we're one of the 5 finals in our area, Southwest Virginia. And our special will be on this coming Tuesday on WFXR. And Paula, I thank you for that. Like I said, we made it to the finals. We didn't make it to the nationals. And I didn't want to because it would have given our organization a lot of money. But we'll try again someday. So that was very fun, and the things we're involved in, but I think the social side is so important. All right, so
10 o'clock news too.
Yeah, so they'll do a little short thing at 6 o'clock news, and then at 10 it's actually the interview. Now they come and hang out for 2 hours, and then you have to sit and wonder, what in the world are they going to put on TV about? So, all right. Yeah.
The whole one that airs at 10 o'clock, the whole thing will be on during the morning hours on Wednesday.
Sometimes they said, I don't know. I think if everybody calls and said, "Oh, we like that, do it again," maybe. But anyway, so Tina,
Yes.
I have a question for you.
Okay.
What are the best candidates for the throat electrocution thing treatment? Is it a one-time treatment?
It's not a one-time treatment. It's several times a week for anywhere between 15 and 60 minutes. Generally, 3 times a week is most basic to get the results of restoring your swallowing. What was the other part of the question? Sorry, I forgot already.
That was it. Who are the best candidates?
Best candidates are anybody that do not have major underlying heart problems, particularly have a pacemaker.
Okay,
They're the ones that are not eligible to have that treatment
Right.
if you have a pacemaker.
thank you. Fidel, how can people know if they are a candidate for HSCT?
To be a candidate for HSCT, they do have screening procedures. The clinic will want to see a MRI of your complete spine to make sure that you don't have any abnormal growths that could possibly grow out of control due to the cytotoxin chemo that is used in the procedure. They also screen your heart to make sure that your heart is healthy enough for the procedure. You see a respiratory specialist to make sure that your lungs are strong enough. And yeah, from there, there really isn't much after that. If you're on a DMT now and you have had active lesions in the past, or you have them now, you're a strong candidate for MS. I was speaking to somebody last night about it, and I don't like the phase 3 clinical trials that are being done here, because they're turning people away because they're telling them their disease is not advanced far enough to qualify for the trial. You know, that doesn't make sense to me. And I told her, I said, well, you don't want your disease to be that far advanced. You don't want HSCT to be well, none of these other treatments worked, so now let's try this. You know, that's not the way it should be. You know, I say all the time, if I had known about it sooner in life, I would have gotten it a lot sooner, because I think it would have been a lot more beneficial to me if I had.
And that's what I was going to ask you to be sure to say that. But of course, then there's the $50,000 price. But the thing is, if you look, and this is why you wonder about insurance companies, if you look at if $50,000 saved you from being on a DMT for years, that could have saved the insurance company a lot of money. But we don't live in a logical country, do we? Let's see. Next is for Hannah. Is there a quick trick to help people develop sustainable wellness habits?
Great question. So when it comes to habit formation, you really want to focus on something very small. Oftentimes when you first are like, okay, you know what, I'm going to start X, Y, or Z habit, you're very excited. So your motivation is really high. And so you want to just dive in with both feet and just go for it, which is great. There's nothing wrong with having that excitement and that motivation to be very high, but oftentimes you're kind of biting off a bit more than you can chew with something like that. And so that's great. If you want to go both feet in, good, but have a backup plan to say, here's kind of my actual bare minimum, my littlest step that I'm going to take when it comes to starting or changing or stopping a habit. What's the littlest thing you're going to do? And think like even smaller than you think you even need to. You might think, okay, I'm going to like eat a vegetable at every meal. That's actually not small, okay? That like got to go even smaller than that, because when you start small and you have success with that, you get a little hit of dopamine in your brain that tells your brain, yeah, that was worth it. I want to keep doing that. And it builds your confidence. And the more you have those little successes, the more you're going to be making progress. So that way you're actually doing something when it comes to that habit that you want to start, stop, or change.
Perfect. Russ, the next question is for you. How do people get involved in the Well Spouse Association, and what does it do?
Okay. Before I answer that, I'm going to answer the previous question.
Okay.
Too. Just want to add one thing. Team building is really useful. If you have anybody else you know who has a similar objective, working with other people to develop habits really is helpful, so that it's self-reinforcing when you have other people who are going to keep after you and going to participate with you. So if you can do that, that will only add to the benefit. And for the Well Spouse Association, the question was how to find out, or
How do people get involved with the Well Spouse Association and what does it do?
okay. It does a variety of things, and it's really easy to get involved. It just depends on what you want to accomplish with it. There is a website, and it's just, you just go on Google and look for the Well Spouse Association website. And on the website, you can look at a variety of things. There are a few things that are only for members, but most of it's open to anybody. You can look for chapters that are local. You can look for groups that have Zoom support groups or local support groups. There is a Facebook, whatever you call it, what's on Facebook?
Groups.
Yeah, sort of Facebook group that meets so that you can join the, I don't use Facebook, so so that if you like Facebook, there is a Facebook Well Spouse group, so you can find people who's the other, who are willing to chat on Facebook or have similar issues. I've done a support group with the Well Spouse Association for a couple of decades, and I've found it really useful, especially at the beginning. It was helpful for me, and at this point, I just try and help other people as much as I can because I've had years of experience. So yeah, there's lots of things that you can do with the Well Spouse group. They also organize retreats. I find the retreats difficult. I've only been to one once, and that was only because it was nearby. Because in my case, well, the two things. One is that in order for me to go to a retreat, I would have to find somebody who could take care of my wife, Martha, for the period I'm gone, which is difficult. And the second thing, I guess, it was never a high enough priority as far as what I wanted to personally do, that I didn't really want to go to a retreat. I'd rather go to a national park. That's my type of retreat. Anyway, so if there's any other questions specifically about Well Spouse, feel free to ask me afterwards, and I can talk to you about it.
There is one more question for you. When is our next cruise?
I can tell you what my next is, but unfortunately, because of Martha's health problems, I've been sort of tied up the last several months. The last 5-6 months have not been a lot of fun, and I haven't had time to work on doing cruises, but I will try and get back to that as Martha stays well long enough for me to get back to it. So yeah, sorry about that.
I have a couple questions for you. So you're popular here. What do you have to do differently for people living with MS than you would for people who don't?
Well, one of the first things I'm reading a lot about, because I'm one of those folks I didn't know much about. I have a friend that lives in Texas, has MS, and she's taught me a lot, is I make sure I don't get you all too overheated or stimulated, because I understand that all it does is exacerbate. Doesn't matter if it's a headache or spine ache or whatever, and I have to be really careful about that. And there's several places all over our bodies that we can touch without aggravating anything that's already sore or tender or whatever. And then the word relax, that's a big deal for whether you have a disease or not. People are just tensing their shoulders. The world we live in today is, but that's what I've learned in the little bit of just coming to your place.
And in your first few visits, you learned real quickly about smells, huh?
Yeah, sure did. And I have to, that's another thing. Sorry about that, Susan. That was one in our interview with her. I asked her about smells because I see a lot of folks with bronchitis and asthma and just gotten over cancer and chemo and those things. And I personally really have to be careful about that. When you come in, if it seems strange, I'll say, can you smell this? Does it bother you? And if it's a bad smell or too strong, I won't use it. And I'm researching everything I can now. So if you all come in and give a massage or anybody, even the chemicals, when I leave, I try to make sure my room is very clean. Even the chemicals I use, I try to make sure there are no smells to it, because when I leave, Suzanne and them, they're still there. And just things like that, so.
And the room is dark. That's one of the
And the
things that
room is
we don't have
dark.
overhead lighting, which is another thing
And
that.
for those of you who already had a massage, I am gonna have some music put in there. I just haven't got my my player yet, so,
Oh, heck, I can bring something in there for you. Okay, I don't know how to say this word, and this is also for you. And whoever said this, if you can correct me, is it lymphoderma?
Lymphedema.
There you go. Say it again.
Lymphedema.
lymphedema.
Is a lymphedema massage more important for people with MS? And are you the person to ask that to, or should we pass that to Courtney? But I do not know.
I can do a lymphedema. There's a whole specialty in massage therapy for lymphedema. Yes, it works, but there again, everybody's different. And if it's already acting up, then we are taught as massage therapists, leave it alone, because there's swelling involved, there's fluid involved. So that's how I would handle it as a massage therapist. I don't know if
Is there something that
one of the doctors.
one of
I
you
can
would
try to
like to
address
say?
it.
Yeah, thank you. Thank you, Lee. Thank you
You're
very much.
welcome.
So in physical therapy, there are lymphedema specialists. There are also occupational therapists who specialize in lymphedema. It's very different than general massage because the lymphedema system is so complex. So if you do want some sort of lymphedema treatment, you can try to go see a physical therapist for it. They kind of have to drain you. So it's almost like we're working what we call proximally. So we're working closer to your trunk and then kind of going outwards. And then what they do afterwards, depending on how bad your lymphedema is they can do wraps and bandages and things like that. It's not something that we do in our clinic, but I know a therapist or two just in the area who do lymphedema drainage if you feel like it's getting bad. Even if you don't have a lymphedema diagnosis and you just have a lot of edema, like a lot of swelling, you can still go see that therapist and get the drainage and get the wraps and everything like that. But it's not something that you're going to be able to do just once. It's something that you're going to have to do a couple times, just depending on how bad the swelling is. But that doesn't necessarily mean like you can never get massage, but it is good to get the drainage first under control and the swelling under control. And then once that is under control, you can go back and kind of start doing massage therapy again.
Okay. Is there a point when neuropathy is too far gone?
That's a great question.
Whoever did that stunned the whole house.
I would like to know the answer because I have neuropathy.
Do you have any thoughts on that, Mary?
Do you mean too far gone
Yeah.
pain or numbness or what?
Like never coming back?
What is the
Or-
I'm sorry,
definition
I
of
wrote
too far?
that, and not for me, but for a friend,
Uh-huh.
and the doctor told him he was too far gone, and I don't believe it.
It's a very complex question.
Russ has got the answer. Well, I don't have the answer, but with my wife, who has a lot of neuropathy and other issues, she gets physical therapy almost daily. And it's not just that we don't expect that she's going to walk again or really improve, but it helps with her range of motion. It helps with her level of comfort so that even when you no longer have neurological control of limbs, etc., it's still useful to keep them moving and keep the circulation going and all the other things that you want to accomplish from physical therapy and occupational therapy and so on. So I would suggest, I think it's shown, everybody remember Christopher Reeves? Okay, one of his treatments after he became a quad was they were doing a lot of physical therapy. Of course, not going to be able to do very much himself, and then there's, what is it, FEV? What's the
FES.
FES, thank you.
Functional electrical stimulation.
Right. So there are a number of ways that you can deal with things like that that are going to be beneficial in your overall health. They're not going to make you walk again, or might not be able to use that limb again, but on your own, but it's still going to be helpful.
Right, thanks.
I'll answer a little bit of that too.
Give it
Oh,
to
go
you.
ahead. Yeah, go ahead.
I think saying that something is too far gone is emotionally insensitive, for lack of better terms. But, you know, it also discourages the patient times 100. I think that, you know, in situations like that, perhaps the provider is saying medical management of this is not achievable. But I think that that's when you introduce outside of the box thinking with things such as physical therapy, you know, taking a look at the medications that we have you on. Usually if my thought, if someone's being told that, is that they're maxed out on every neuropathy drug that we know how to put you on, or you've tried and failed different things. So taking a look at that and kind of restructuring, do we need to reintroduce, pull things out, you know, make changes? But I think no matter what, to tell somebody something is too far gone, even if we in our mind know that, you know, we can't probably ever get rid of it, it should still be, you know, we have to change our frame of thought. So physical therapy, occupational therapy, supplements, massage, you know, what other things can we do to make you have a little bit less? Maybe it won't go away, but just a little bit less.
I'm afraid he's given up, and he does fall a lot.
Yeah.
I want to add a couple of things to this. How many of you are aware of JIMO? JIMMO?
Medical Association.
No. Okay, it's a court case.
It's a law. Yeah.
Okay. So years ago, the Center for Medicare Advocacy had a court case against Medicare and Social Security and a bunch of others, because they were doing things that were really stupid, like that comment about the person being too far gone, where basically, if you have MS, for example, and with MS isn't a disease that you, no, I'm not gonna put it this way, it's a progressive disease, and you're likely to progress. You don't have to progress, but the point ends up being is that if you go see a doctor, and they have an attitude like that, like what you described, you want another doctor.
That's what.
But JIMO basically says that you don't have to improve to get medical treatment. And that includes occupational therapy, physical therapy, any sort of medical therapy. So if it's beneficial for you to keep you healthier, to limit your decline in any way, legally speaking, the doctor is supposed to treat you, Medicare is supposed to pay, and other insurers are supposed to pay also.
That's interesting. Thank you for sharing that. Don't we have some dictionaries here, don't we? I mean, encyclopedias of people.
Something Marion and I were talking about earlier is it's hard to say, you know, I don't even want to use the term that was written, but it's hard to say when we've kind of reached that point. We don't know. I have people come to see me as a physical therapist and they're like, am I going to make progress? Am I going to make this? And I can't answer that until we at least try it. So some things are truly a trial and error. And I would love to say like, oh, well, you're maxed out on this and this isn't going to work anymore. We don't know until we try it. But honestly, I mean, you got a great MS provider here who is going to try everything under the sun. So I think like in situations where if you think like is my neuropathy too far gone or something, is there any way that anywhere else I can treat this? There's always going to be 1,000,001 ways to probably treat it. Now, is all that covered under insurance? Probably not. But there's going to be options that you can always try, and there's always new stuff coming out too. So don't just think, oh, well, they said 5 years ago I was done. No, there's probably something new out in the market that could help someone or something, and definitely go back and always ask questions to one of your providers.
Okay. So we're on our last few questions. So Tina, I think this would be you. With throat tightness, is strangling a part of it?
Yes. So what happens is when you get throat tightness, if you have spasticity in your throat muscles, it's going to make your choking episodes become more frequent. Part of what speech therapy can do is teach you how to relax those muscles, as well as different massage techniques and exercises and therapy techniques that we can do to help alleviate the throat spasticity to allow you to have a more functional swallow and better be able to eat and drink.
Thank you for the additional 75 words. I really
You're
appreciate
welcome.
that. Fidel, who's been your caregiver?
As far as,
The question was, who's been your caregiver? I don't know if that started, somebody wants to clarify, I don't know if
yeah,
that
you're
started.
talking
with you
about my
going-
doctor,
So when
my
you go,
wife.
Yeah.
I'm sorry. Oh yeah, my wife, she's been, we've been together for 11 years, and she's been there every step of the way with this disease. So when the neuros that I've seen, Dr. Faria Amjad at MedStar Health in DC. I live out in King George, Virginia, and I currently see Dr. Virginia Baker. I believe she came out and presented.
Mark
Yeah.
Agler.
She's great. She's actually in the process of opening the first MS clinic in Fredericksburg.
Cool.
So she's awesome.
Thank you. So I had a closing question, but y'all have helped me. Well, there's another one here. Okay, I think this is probably going to go towards Marion or Sarah. But it basically, anyway, would it do us any good to bring a copy of our blood work from our primary care doctor to an appointment, I guess?
Ideally, we will already have it, but yes, is the answer. It just helps it, we have it right there. You and I can sit and go over it. Sarah, would you agree with that sentiment?
Usually I can find it on my phone.
Yeah.
But we're often doing that, so it's very helpful.
Yeah, very
And if you
helpful.
have a paper copy, we can scan it and then keep it, so that's even better.
Yep, it helps us not to double dip in things that we may need, but also to just kind of have an idea quickly.
Just to mention, you should ask your doctors whether they're on Epic or they use Epic,
My chart.
which is, the patient portal for Epic is MyChart. But Epic is the overall system or company that does all these, maintains all these medical files and maintains them across lots of hospital groups and all sorts of other groups. Some private practices don't use it because it's somewhat expensive to use. But if your doctor's using Epic, anybody else using Epic can find all this information immediately. So.
Yes, we do not use Epic at the Blue Ridge Association. I tried really hard, but we do not use it. However, to his point, inside the medical system that we have what's called Prisma, which is attached to Epic. So if you go, UVA, any Carillion system, all of those labs are accessible to us if they were done within the past year.
So before I get to the last question, Marion, since you're holding that, once again, you and or Sarah or whoever, you've started something new at our center, and that's biomarkers.
Mm-hmm.
And I don't know if everybody understands it. What I've seen happen is something that I've read about for a long, long time that I didn't dream I'd live long enough to see. And if you could just give a short explanation or whatever of what you're doing, the biomarkers, you're with an outstanding company and it's real exciting to me. So I don't know if everybody understands biomarkers, but it's a huge deal. So.
Sure. So when I was at CMSC last year, which is the Consortium of Multiple Sclerosis Centers, it's the largest gathering of, I'd say, mid-levels, physical therapists, nurses, and providers within the country outside of ACTRIMS. However, anyway, so last year I was looking at the sessions I wanted to go to, and there was a doctor from New Zealand presenting on serum biomarkers. So we're used to seeing biomarkers in the cerebral spinal fluid, which is done during lumbar punctures, but they've started doing them now where we can get them through your blood. So I sat in on this lecture and I was just like, this is amazing. you know, what I found amazing about it is that it's a simple lab draw. We're getting your labs usually at your visits anyway. But the details that it provides about your multiple sclerosis and the specificity of the biomarkers is what really fascinated me the most. So the long short of it, you know, when you have your MRI, you're looking at a 2D image where you see new lesions or you don't. But you don't see inside of those lesions. You don't see how those lesions are actually behaving. And so what the blood test does is it pulls out 18 proteins that make up the inflammation involved in your multiple sclerosis lesions. And it breaks them down looking at chronic inflammatory marker, acute inflammatory marker, and then a couple other ones that are usually associated with what kind of DMT you're on, or other disease and inflammation pathways of your multiple sclerosis. So when we draw this lab, what you as the patient will see is a scale of 0 to 10. Anything below 5 means that your multiple sclerosis within a 3 to 6 month time frame is well controlled with whatever you're doing. That could be not on DMT, on DMT, what have you. Anything above 5, obviously closer to 10, we've got some concerns. But I tell people, just because your score comes back as, let's say, a 6 or a 7, that's where breaking down those 18 different protein results gives us more idea of what actually is making you a 6 or a 7. Is it because we're looking at acute inflammation, which means, hey, we're looking at perhaps a relapse or a flare? Or are we looking at more chronic? Are you in more of a progressive chronic phase? You know, the longer you've had the disease, the more progressive it's been throughout your course. Do we anticipate for you to have a little bit higher of a biomarker? Yes, but the important part is that whatever your baseline is, in 3 months or 6 months when we retest it, I want it to be the same thing. Or if we are saying, oh my gosh, my acute inflammatory marker was higher, we have conversations, we switch your DMT, what have you, which would not solely be based off of this blood work. It would be a combination of how you're doing clinically, MRI, and this blood work. If we make that DMT switch and then repeat it, my anticipation would be that the number gets better. You know, so there's a lot of factors that go into it, but it's just one more piece of complement to look at how your disease state is doing. You know, in New Zealand, they're actually replacing MRIs with it because it is that specific to your MS. You know, we're not there yet. My goal and dream and hope would be that we will one day, because it's, you know, saves money. The test itself is the company that we work with, they either pay for it completely, or at the most it's $99. So when you look at MRI cost, it is much more affordable. Also, don't have to deal with the claustrophobia and all that stuff. So in a perfect world, which we'll never have, but in my ideal scenario, maybe in 5 to 10 years, we'll be utilizing it more than we are MRIs. But it's really interesting. I encourage you to talk to your healthcare provider. I'll be speaking on it actually at CMSC this year. That's how much I'm interested in it, and the research behind it is just really extensive and really amazing.